The American healthcare system operates on a clear set of rules established by federal law. These rules dictate who can and cannot access taxpayer-funded health programs. For decades, the legal framework has been firm: illegal immigrants are not eligible for most federal healthcare benefits. This includes major programs like Medicaid, which provides comprehensive health coverage to low-income Americans, and the subsidized insurance plans offered on the Affordable Care Act marketplace. This exclusion is not a recent development or a political talking point. It's a long-standing principle embedded in our nation's laws, designed to reserve these finite resources for citizens and lawfully present immigrants. When politicians debate extending tax credits or adjusting healthcare funding, it often creates confusion. Many people are led to believe these changes will open the door to new benefits for illegal immigrants. However, this is largely a misinterpretation. The ACA's premium tax credits, which make insurance more affordable, are explicitly denied to those without legal status. They cannot purchase a plan on the federal marketplace with or without a subsidy. So, heated debates in Washington about extending these credits are irrelevant to this population. Federal law remains a strong barrier, ensuring that taxpayer dollars for these specific programs are not diverted. It is crucial to understand this distinction between federal and state responsibilities. The federal government sets the baseline, and that baseline is one of exclusion for illegal immigrants when it comes to Medicaid and ACA subsidies. The only major exception at the federal level is the Emergency Medical Treatment and Labor Act, or EMTALA. This law requires Medicare participating hospitals to provide emergency care to anyone who needs it, regardless of their ability to pay or immigration status. This is a safety net for life-threatening situations, not a comprehensive health plan. It's a system designed to prevent deaths on the hospital steps, but it leaves all other medical needs unaddressed. The clarity of federal law forces us to look elsewhere to understand the real costs of healthcare for illegal immigrants. Because Washington has drawn a clear line, the financial and social pressures have shifted to the states. Some states have chosen to cross that line, using their own funds to create programs that the federal government will not support. This has created a fractured landscape where an individual's access to taxpayer-funded healthcare depends entirely on which side of a state border they reside. This state-level activism is where the true story of rising costs and strained resources begins to unfold, far from the halls of Congress. As of 2024, an estimated 25 million American citizens remain uninsured. These are our friends, neighbors, and family members who fall through the cracks of a complex and expensive system. They're often hard-working individuals in low-wage jobs that don't offer health benefits, or small business owners who just can't afford the high cost of private insurance. For them, a sudden illness or accident can mean financial ruin. They live with the constant anxiety of knowing that a trip to the emergency room could lead to crippling debt. These citizens play by the rules, pay their taxes, and yet find themselves without the basic security of health coverage. In stark contrast, a growing population of illegal immigrants is gaining access to public health services, often at no cost to them. While they are barred from federal programs, an increasing number of states are creating parallel systems to cover them. This creates a deeply unfair situation. An American citizen in a state without expanded Medicaid might be denied coverage, while in a neighboring state, an illegal immigrant could receive a full range of benefits paid for by taxpayers. The number of illegal immigrants utilizing these services is difficult to pinpoint precisely, but enrollment in state-specific programs has skyrocketed into the hundreds of thousands, and in some cases, over 1 million. This tale of two realities highlights a profound disconnect in our nation's priorities. We're told that resources are scarce, and that universal coverage for citizens is an unattainable goal. Yet, billions of dollars are being allocated at the state level to provide healthcare to individuals who are in the country illegally. The uninsured American citizen is often told to find a better job, save more money, or simply hope for the best. Meanwhile, political leaders in certain states are actively creating and expanding programs that place the needs of non-citizens on par with, or even ahead of, the needs of their own legal residents and taxpayers. The moral and economic implications of this disparity are staggering. How can we justify a system where a tax-paying citizen is forced to launch a GoFundMe campaign to pay for cancer treatment, while state budgets are strained to provide free healthcare to those who have broken our immigration laws? This is not a question of compassion, but of fairness and responsible governance. The plight of the uninsured American should be our primary concern. Instead, their struggles are often ignored in the rush to create taxpayer-funded safety nets for a population that resides outside our legal framework. California stands as the most prominent example of a state creating a comprehensive healthcare system for illegal immigrants. In January 2024, the state expanded its Medi-Cal program to cover all low-income illegal immigrants, regardless of age. This move made California the first state in the nation to offer universal healthcare access to this population. Enrollment numbers quickly swelled, with projections indicating that over 700,000 newly eligible individuals would sign up by 2025. The estimated annual cost of this expansion is a staggering $3.1 billion, a financial commitment made at a time when the state was already facing a significant budget deficit. This decision represents a clear political choice to prioritize non-citizens. New York has followed a similar, albeit more cautious path. While the state has not yet implemented full-scope Medicaid for all illegal immigrants, it has expanded coverage options significantly. New York City's NYC Care program guarantees healthcare access to all residents, including the undocumented, through its public hospital system. Statewide, there are ongoing pushes to expand the Essential Plan, New York's public health insurance program, to include all low-income immigrants. These efforts are projected to cost taxpayers hundreds of millions, if not billions, annually. The debate in Albany is no longer about if they should provide this coverage, but how to fund it, signaling a major shift in public policy. Even in Texas, a state known for its firm stance on immigration, the costs are immense, though they manifest differently. Texas has not created a statewide insurance program for illegal immigrants. Instead, its costs are driven by uncompensated emergency care mandated by federal law. County-run hospital districts, particularly those along the border like in El Paso and Hidalgo County, are overwhelmed by the financial burden of providing this care. These hospitals act as a de facto safety net, and the unpaid bills are passed on to local property taxpayers. In 2022 alone, Texas hospitals provided over $7 billion in uncompensated care, a significant portion of which is attributable to the immigrant population. These three states, with their vastly different political landscapes, illustrate the escalating financial impact of this issue. California's proactive expansion, New York's incremental approach, and Texas's reactive absorption of emergency costs all point to the same conclusion. American taxpayers are footing an ever-growing bill. Whether through direct state appropriations or indirect absorption of hospital losses, the financial commitment is undeniable. These state-level decisions have effectively created a new entitlement, one that circumvents federal law and places an enormous strain on public resources that could otherwise be used for citizens. The decision to fund healthcare for illegal immigrants is not made in a vacuum. It has severe consequences for state budgets. In California, the expansion of Medi-Cal to all illegal immigrants came as the state stared down a projected $68 billion budget deficit. To fund this new entitlement, lawmakers must make cuts elsewhere. This means less money for schools, infrastructure, public safety, and services for other vulnerable populations, such as the elderly and the disabled. The $3.1 billion annual price tag is not just a number on a spreadsheet. It represents a direct trade-off, where programs benefiting citizens are sacrificed to extend benefits to non-citizens. This fiscal strain is not unique to California. In every state that has ventured down this path, the costs have consistently exceeded initial projections. As word spreads that free healthcare is available, enrollment numbers surge, creating a budgetary black hole. For example, a program in Colorado that started with modest projections saw its costs balloon as enrollment far surpassed expectations. Lawmakers are then faced with an impossible choice: either cut the program and face political backlash, or divert even more money from other essential state services. This dynamic puts state budgets on an unsustainable trajectory, driven by a demand that is, by its nature, unpredictable and uncontrollable. Furthermore, the financial burden is shouldered entirely by state and local taxpayers. Federal law prohibits the use of federal matching funds for these state-created programs. This means that while a state receives federal help to pay for a citizen on Medicaid, it receives zero federal dollars for an illegal immigrant on a similar state-run plan. This policy forces states to use 100% state-generated revenue, your income taxes, sales taxes, and property taxes, to cover the full cost. As a result, the tax burden on citizens rises to subsidize a service for a population that, for the most part, contributes very little to the tax base. The long-term fiscal health of these states is now at risk. By creating open-ended entitlements for a growing population, states are making financial promises they may not be able to keep. The rising costs consume an ever larger share of the budget, crowding out other priorities and limiting the state's ability to respond to future crises, like a recession or natural disaster. This is not a compassionate policy, it is a reckless fiscal gamble. It prioritizes a political agenda over sound financial management, and it is the tax-paying citizens of these states who will ultimately pay the price for this irresponsibility. Hospitals, particularly their emergency rooms, are on the front lines of America's immigration crisis. Under the Emergency Medical Treatment and Labor Act, or EMTALA, they are legally required to screen and stabilize any patient who walks through their doors, regardless of immigration status or ability to pay. While noble in principle, this mandate has turned emergency rooms into the primary source of healthcare for millions of illegal immigrants. They often arrive with conditions that could have been managed with preventative care, but because they lack regular access to doctors, their health issues escalate until they become emergencies. This leads to severe overcrowding and diverts resources from other patients in critical need. The financial pressure on hospitals is immense. When an illegal immigrant receives emergency care, the hospital is often left with the bill. This is known as uncompensated care, and it has reached crisis levels across the country. In 2023, American hospitals provided over $50 billion in uncompensated care, a substantial portion of which is directly linked to treating the uninsured immigrant population. This is not free care. The cost is absorbed by the hospital and then shifted to others. To cover these losses, hospitals raise the prices for paying customers, meaning that everyone with private insurance ends up paying higher premiums and deductibles to subsidize this system. Longer wait times in the ER are a direct consequence of this overcrowding. When emergency departments are filled with patients seeking non-emergency care, individuals suffering from genuine life-threatening events like heart attacks or strokes are forced to wait. Reports from border states and major cities show ER wait times stretching for hours, sometimes with tragic results. This is a public health crisis that affects everyone. An American citizen in need of urgent medical attention might find their care delayed because the system is clogged with patients using the ER as a primary care clinic, a situation made worse by the influx of a large population without access to routine healthcare. This strain is pushing many hospitals, especially smaller and rural facilities, to the financial breaking point. Some have been forced to close their doors, creating healthcare deserts where citizens have no local access to emergency services. The debate is often framed around the idea that providing this care is a moral imperative. But what is the morality of a system that forces community hospitals to go bankrupt, leaving thousands of American citizens without care? The hidden costs of uncompensated care are not just financial. They are measured in longer waits, reduced services, and shuttered hospitals, degrading the quality and availability of healthcare for everyone. The debate over healthcare for illegal immigrants forces America to confront a fundamental question of national priorities. On one side, advocates argue that providing healthcare to everyone, regardless of immigration status, is a matter of public health and human decency. They contend that untreated illnesses can spread, and that it is ultimately more cost-effective to provide preventative care than to wait for costly emergencies. From this perspective, denying care is both inhumane and impractical, and a civilized society has a moral obligation to care for the vulnerable, no matter where they come from. This viewpoint drives the policy decisions in states like California and New York. On the other side is a powerful argument rooted in fairness, fiscal responsibility, and the duties of a sovereign nation. This perspective holds that the primary obligation of the government is to its own citizens. With millions of Americans uninsured and our healthcare system already under immense strain, it is both illogical and unjust to divert billions of taxpayer dollars to provide benefits to those who are in the country illegally. Proponents of this view, like Texas officials grappling with uncompensated care, argue that every dollar spent on an illegal immigrant's healthcare is a dollar that cannot be spent on a veteran, an elderly citizen on a fixed income, or a struggling American family. This is not an abstract debate. It is a zero-sum game of limited resources. The evidence is clear. State-funded programs for illegal immigrants come at an enormous cost, straining budgets and forcing cuts to services for citizens. Hospitals are buckling under the weight of uncompensated care, leading to higher costs and longer wait times for everyone. The promise of healthcare for all is a powerful slogan, but in practice it has meant prioritizing non-citizens over the very people the government is sworn to serve. We are creating a system where law-abiding, tax-paying Americans are treated as a lower priority than those who have broken our laws. As a nation, we stand at a crossroads. We must decide whether our finite healthcare resources should be reserved for the citizens and legal residents who form the backbone of this country, or if they should be extended to an ever-expanding population of illegal immigrants. Should we continue down a path where states create unsustainable entitlement programs that undermine federal law and fiscal stability? Or should we reassert the principle that citizenship has meaning and that the needs of our own people must come first? The evidence shows the current approach is failing. It is time to have an honest conversation about our priorities before the system breaks entirely.